Once absorption is done, we have to move toward the distribution. So distribution is the net movement of the medication from circulation to the body tissues. Rate and extent of distribution depend upon several factors. Number one is the blood supply. Drug distribute more in the organs which have more blood supply or rapid blood distribution like brain, liver and kidney. And the areas where the blood supply is low, they got lesser drug distribution like the adipose tissues. Now we have to talk about the brain, how medication pass through it. Brain has the blood-brain barrier that strictly regulates the movement of the molecules. So the larger water-soluble medication, they can't cross it and they have to move across it. Where the smaller fat-soluble medication can easily cross the blood-brain barrier. Now we have to talk about the second factor, that is size and the polarity of the medication. Smaller hydrophobic or lipid soluble medication can easily cross the membrane as compared to the large hydrophilic medication that needs support for the movement. Another factor that is going to affect distribution is the degree of plasma protein binding. Medications travel through the bloodstream when they are going to partially bound to the plasma protein or partially unbound. Partially unbound mean they are free to diffuse into the tissue, where partially bound mean they remain limited to plasma. So partially unbound drug is free to diffuse into the tissue. So the medication which have less plasma protein binding, they can easily distribute it into the tissues, where the medication with high plasma protein binding, they take more time, longer duration of action. Now we have to talk about the apparent volume of distribution, that is the VD. VD is the hypothetical volume that accommodates all of the medication in the body. Let's move toward an example. For example, we have a medication that is 100 milligram and we have to inject it intravenously. So after 1 hour, the medication is going to be 50 milligram per liter in the blood. So now we have to calculate the VD. For that one, we have to use the formula dose administered intravenously in milligram divided by plasma concentration of medication milligram per liter. So 100 divided by 50 mg is 2 liter. At this time, we have to assume medication is distributed evenly throughout the body. That's not the case for all the medication. Smaller lipid soluble medication can easily cross the membrane and distribute it into the extracellular compartments, tissues and in the fats, where the large water soluble medication, they can't cross the cell membrane, so they are going to remain in the plasma. So the medication with smaller volume of distribution less than 3 liter, they will remain in the plasma, and the medication with larger volume of distribution greater than 16 liter, they will remain in plasma and interstitial fluid. But the medication with larger volume of distribution greater than 46 liter, they can possibly distribute throughout all the body compartments. Certain situation where VD get altered. For example, in the case of cirrhosis, unable to produce enough plasma protein, and in the case of CKD, mean chronic kidney disease, excess amount of plasma protein got filtered out, due to which the plasma protein bound medication is going to reduce and the volume of distribution is going to increase. Now we have to do a quick review. So first thing is the absorption, movement of the medication from the site of administration to the circulation. It depends upon the passive diffusion, facilitated diffusion, active transport and the endocytosis. It can be determined by route of administration, pH of the environment, chemical properties of the medication, surface area and the blood supply, and the last thing, the contact time with the surface area, and the last one is the presence of food and the other medication. Bioavailability is the measurement of absorption. Distribution is the movement of the medication from the circulations to the body tissues, and it can be determined by the blood flow to tissues, size and polarity, and the plasma protein binding. with apparent volume of distribution is the measure of extent of distribution and can be affected by certain kidney and liver conditions.